Acne vulgaris or pimples or spots is a common chronic inflammatory skin disorder involving the hair follicle or sebaceous gland, which presents mainly in adolescents. And a variety of spots appear mostly on the face and other parts of the body. Severe acne may require evaluation to exclude an underlying hormonal disorder. This condition may induce some psychological disturbances. The choice of treatment depends on age, severity, and whether the acne is predominantly inflammatory or um, comedonal. The causes are increased sebum secretion, and also abnormal keratinization of the hair follicles is usually hereditary. Increased sensitivity of the sebaceous glands to male hormones, and also Propionibacterium acnes, and prolonged use of systemic and topical steroids, for example, anabolic steroids such as danazol, stanozolol, and also nandrolone, and the use of pomades, especially products that contain lanolin and petrolatum, also vegetable oils, butyl stearates, lauryl alcohol, and oleic acid. Also contraceptive agents like medroxy, progesterone injection, implanted or intrauterine progesterone, and also oral contraceptives, and pregnancy, polycystic ovarian syndrome, and also adrenal disorders. So the main symptoms are pimples on the face and occasionally on the trunk, chest, and shoulders, greasy skin, and facial disfigurement. Signs that are usually elicited are papules, cysts, scars, nodules, pustules, comedones, blackheads and whiteheads, and hirsutism, which suggests excess androgens. Investigations, usually none. Serum testosterone in females with accompanying hirsutism and virilizing features. Also pelvic ultrasound in females to exclude polycystic ovaries in that's if hirsutism is present. The main treatment objectives are to improve cosmetic appearance, to prevent complications, particularly scarring, to reassure patients, and to identify and avoid any causative or contributing factors. Non-pharmacological treatment, counseling of patients is recommended. Pharmacological treatment for mild to moderate acne: benzoyl peroxide 5% lotion, topical, usually prescribed, applied daily. Avoiding the mouth, eyes, and mucous membranes. Also clindamycin 1% lotion or gel, topical, and this one to apply daily. Or tretinoin 0.01% gel, topical, you apply at night, that's knocked, and avoid the eyes, nostrils, the mouth, mucous membrane, and broken skin. Also avoid the sun. Topical retinoids like tretinoin are contraindicated in pregnancy. You could also use adapalene 0.1% cream or gel, topical, which you apply thinly once daily at night before sleep. For moderate to severe acne, or where topical therapy is ineffective or not tolerated, use the topical treatment I mentioned, and also You add doxycycline oral in adults 100 milligrams daily for 6 weeks to 6 months, depending on response to treatment. In children, it's not recommended. You can give tetracycline oral in adults 250 to 500 milligrams 12 hourly for 6 weeks to 6 months, depending on the response to treatment. Change medication to erythromycin after 4 months if response is poor. And for children more than 12 years, give the same dose as adults. Less than 12 years is not recommended. You can give erythromycin oral in adults 500 milligrams 12 hourly for 6 weeks to 6 months. In children more than 12 years, 500 milligrams 12 hourly for 6 weeks to 6 months. And 1 to 12 years, 125 milligrams 12 hourly or 250 milligrams once daily for 6 weeks to 6 months. So referral criteria: refer patients not responding to treatment to a dermatologist. Um, Suspected underlying endocrine conditions should be referred to an endocrinologist.